Dr. Delaby here is Dr. Manuel is a friend of mine. We've known each other for a long time. So we've been on a relationship where, you have iron striking iron, and he's one of those. Also on the tennis court, he just beats me with like a drum. It's awful. It's just terrible. And but he has done his doctorate in emotional intelligence. So that's what we're going to be talking about today. The main topic of today, though, is this issue of burnout. Okay, the idea of losing our passion for medicine. And this is one of the things that has driven medicine into the ground, so to speak. And so the burnout rate currently is being studied by wellness studies of physicians. Now this is doctors over age 50 and above. We find that the wellness studies have shown that 37% of doctors have lost their passion and their engagement in medicine. That's in 2013. 2015, that number rose to 47%. Okay, the burnout rate in medical school and among residents is roughly around 60%. So you can imagine what the burnout rate in physicians are today. 2017 is still being gathered, information is still being gathered. So the question would be is why is that happening? We find that in medicine, we learn that there are several things that cause the burnout. Okay? And that is, we teach medicine by the biopsychosocial method. So we teach medicine in terms of the biological sciences, and we find out what the disease is and what to do for the disease. The fact is that technology has gone out the roof here, and we realize that what has happened is we have so much information, more and more faster and faster. The goal, though, in medicine here in Parkland, was I did my residency here, and what I learned in orthopedics was that the 3 A's, and you know what those are: availability, affability, and ability, in that order. So the idea of performance is at the highest level. So you have to be there, and you have to be able to perform at highest level perfectly. And so the question is, how many perfect doctors have you met lately? It should be 0, and it will continue to be so. The problem is that when we have an unrealistic goal like that, performance level at the highest level, the performance that was demanded of us is perfection, and because there's no perfect doctors, we have a problem. Causes a lot of stress, a lot of anxiety, a lot of problems with just losing our passion in medicine. Because you all came here for the right reason, to help people. I know you did, or you wouldn't be here. But the thing is that what we do, if that's the demand of medicine, to be perfect, and there's no perfect doctors, then what happens is that leads to disappointment, disillusionment, depression. So what happens is it's a downward spiral. Okay? And the problem is that began 50 years ago. It was in the issue of the Roe versus Wade issue. Okay? And the problem is when we have before us something as wonderful as the Hippocratic Oath, one of the key points of the Hippocratic Oath is that we will do no abortion or refer to when it does. It will do no euthanasia or refer to when it does. Okay. Now the problem is when it's made a law to do that. Okay. What has happened is our knowledge has gone out the roof. Okay. But our trust level has gone out the floor. So the core of medicine is all about trust. Okay. And if we kill babies and we kill people, can we be trusted? So you see where the problem is. It's a core issue that we have to deal with in medicine. So in order for us to get above that level, we have to go to the 3 C's, which you all know about. And this is to develop a spiritual component to our life. Okay? Because the 3 A's have to do with technology, technos. Techno, which is skill, and ology, the study. Okay, so we become mentally prepared. Now, all of you, even though sometimes you'll be thinking that you're not going to be a good doctor, okay? I'm here to tell you that you are going to be good doctors, okay? You're all gonna end with an MD degree or a PhD behind your name, okay? And you're all gonna do well. Now, the thing is now, how do we then deal with this thing called distrust? Okay? And so what I'm here to tell you also that there's called an SQ or spiritual intelligence that's involved. And for us to get to the 3 C's, which is compassion, character, and competence in that order. See, it's not an either or, it's a both and. See, so you're all going to be good doctors, but I believe that God intends for us to be great doctors. Okay. Now, how we do that is that we need to consider restoring that trust. How do we develop that? Okay. Ephesians 2 says, by faith, we are, for by grace through faith, you see, that's the way that God does it. For by grace are we saved through faith, and that not of ourselves, it's a gift of God, not of works, as any man should boast, because we are God's workmanship created in Christ Jesus. So the way that we do this is Romans 10:9 and 10, where it talks about, if you believe in your heart that Jesus is Lord, confess with your mouth that He's raised from the dead, you will have the free gift of eternal life. That opens up the door for spiritual portion. But you have to have a little humility to do that. How do we make that a reality in our life? To make trust a major focus that comes back into our lives so that we can be trusted. And now this is the talk that we're going to be talking about with Dr. Emmanuel. We're talking about the issue of emotional quotient in the sense that there are the 3 H's involved. 3 H's are first chesed, which is covenant love, then humility, and then what we call honesty or honor. It's called hagios. The idea is to be holy because God Himself is holy. So now what that does is it draws people to want to trust us. Okay? Because if they like us in the 3 A's, they'll listen to us. But they won't follow us unless they trust us. Okay, does that make sense? So now what we're going to do is talk about this whole idea of engendered trust so that people will follow us as we are servant leaders in the area of medicine. So Dr. Delavi is going to help you. And
I was enjoying listening to you.
Oh, yeah.